We stand and watch it quiet. It's really as easy as that. You're just glad you woke up this morning.
The Whipple was named after the guy who basically developed the initial technique for removing the head of the pancreas, the first part of the intestine, and all the lymph nodes around it, where cancers in that area are most likely to spread to.
Dr. Dittrich went through, pretty much everything. This is what we need to do to help you live. So that's what we did.
This is one of those surgeries that is much better to have someone doing it 20 times a year than 20 surgeons doing it once a year. And that centralization of care, which has really taken place over the last 5 to 10 years, certainly has improved surgical outcomes, both on a short-term recovery standpoint and from a long-term oncologic standpoint.
Surgery was not an option for me. I was stage 4. So I had spread from my pancreas to my liver. It saved my life. I'm 2.5 years past my expiration date that I was given, so I'm doing pretty good.
We know that what we do right now isn't good enough. And we know that the only way that we can get better at what we're doing is by doing clinical trials. And so always we have to keep trying to improve.
Best practices are occurring here. It's someplace local. You don't have to try to travel to another big health system. What do patients need to be successfully treated for pancreatic cancer? Not only from the medical standpoint, the surgical expertise, the workup, the diagnostic, that's part of the care, but also that supportive care that they really truly need to be successful. We started to look at the support services that would have an impact. So looking at genetics, social work, counseling. We started to look at nutrition. What were things that we could do to help these patients thrive in all these different aspects of treatments?
We're starting to see improvements. We're starting to see gains in keeping people disease-free 5 years down the road. Not 5 minutes after the surgery, but true long-term meaningful benefits and chances of cure that are better than they have been. We have a long way to go, don't get me wrong, but there's a lot of progress being made.
Going through chemo, facing mortality, for me to be I celebrated my 3rd Christmas this year after being post-diagnosis, so things are looking up. It's good. So I always tell people, just never give up.
I'm much more emotional than I used to be. That's what I tell them. Never ever give up.